Hello, I'm Usman Last, and I'm happy to share my capstone project entitled Evaluation of Effective COVID-19 Provider-Patient Vaccine Messages Among Black New Yorkers. Nationally, since the start of the COVID-19 pandemic, the mortality rate for non-Hispanic blacks has exceeded their share of the overall population with a death rate of 13.7% compared to their overall percentage of the population at 12.5% according to the CDC. Despite this discrepancy, vaccine uptake has been a challenge throughout the pandemic and messaging remains untested. Given this reality, the problem is that there is little to no literature testing health messaging communications and approaches for their effectiveness in the Black population. Lessons can be learned from current viruses and pathogens with similar characteristics and challenges. A big insight from a CDC meta-analysis of flu communications over a 14-year period found a clear theme, which was the need to recognize that vaccine decisions are made similarly to other health and medical decisions. An October 2021 report in the Public Health Journal Vaccine, with a study of 1,668 participants, found that Black individuals who are vaccine hesitant prefer to be told about the COVID-19 vaccine during a conversation with their doctor, and they prefer to be vaccinated at their doctor's office. This grant would implement a one-year clinic-based intervention using a randomized controlled trial method, recruiting 1,500 unvaccinated patients who receive care at health and hospital facilities. These facilities were chosen since Black New Yorkers were found to be half as likely as white New Yorkers to receive care in academic medical centers. The evaluation of the study will be based on two exposure variables and their impact on patients' vaccination decisions. First, a script framing possible losses or gains from COVID-19 vaccination, and second, a doctor's offer or recommendations to get vaccinated. Finally, a $25 gift card incentive will be provided to participants. Here is a graphic representation of the exposure variable of various frames, a gain frame, loss frame, and no framework at all. This is followed by equal distributions into respective groups. The logic models shown identify and clarify the expected processes for framing gains and losses, as well as processes in doctors' offices. Expected outcomes of this initiative are higher vaccination rates among participants. Success will be measured by evaluating the impact of exposure interventions on patients' implementation of the multi-dose vaccination series. Additional methodology include chi-square testing and evaluation of the p-value and relative risk scores, as well as monitoring participants to determine their full vaccination status. The process and outcome of this grant is based on a similarly structured study of hepatitis B vaccination patients. In that study, it found that higher vaccination implementation rates among those who were recommended the vaccine versus offered it. Additionally, among participants who received the loss, gain, or no frame, higher uptake was seen among those who received some framing versus none at all. Both intervention variables resulted in at least 50% participants receiving their first dose, followed 25% receiving their second dose, and 10 to 16% uptake of their third dose. The total budget for this grant would be around $200,000 through the CDC and would cover expenses for the research team, partner organizations, and continued personnel costs. I'd like to also note the need for plans for sustainability and need for awareness of limitations such as limited connection to care and focus on doctors only in this particular study. Ultimately, there is a need for additional evaluation and studies, which remains for this issue area. I'd like to acknowledge Dr. Anur and Jackie for their support through this capstone process. Thank you.